Welcome to the PUTTcast podcast by Pharmacists United for Truth and Transparency. Pharmacists United for Truth and Transparency is the only registered 501c3 nonprofit wholly dedicated to exposing the hard truths about pharmacy benefit managers and how their greed-centered profit-at-any-cost business practices are driving up drug prices and healthcare premiums while reducing consumer choice and endangering patient access. To learn more, visit our website at truthrx.org.
Welcome back to this episode of the PUTTcast. We have one of our favorite friends on with us. We have Greg Reybold, the Vice President of Healthcare Policy for APCI, and you were nice enough to join us for our last episode with Congressman Auchincloss, where we discussed HR 9096. So we've invited you back to help figure out how we can save the world from PBMs. Welcome back, Greg.
Thank you so much. Always a pleasure to join. I thought that was a great conversation with Congressman Auchincloss, and looking forward to jumping into even more details here. I was just thinking, it's really tough, this younger generation, I'll get 30 likes and I'll show my son, look at this, 30 likes. And he's like, that's nothing, Dad. That's it's very hard to impress, my 13-year-old son. But when I showed him the Congressman Auchincloss tweet and he saw 7 million, he was like, whoa, that's that's when I knew it was big, right?
That's right. It is big. And I think with all of the different people that spoke at that hearing, I mean, there was, clips of videos going around, but the fact that he really drove home a lot of the points, and even the percentages of the drugs being marked up, what was it, 34,000% or something for an MS drug?
34,000%, yeah.
Oh, God. That number shouldn't even exist whenever you're talking about drug pricing increases.
And they go up from there. That's the sad thing. We're in a world where when you start looking at some of these drug pricing markups and you see 300%, which shouldn't stand in and of itself. 300% is wrong, but you see 300% and it's underwhelming because, you're used to seeing just, make-believe percentages. So. Mm-hmm.
Absolutely. Well, I know that there's some legislators that have been a little apprehensive about this bill, and, they think that they're not quite sure if they can get behind going full throttle with it. So I really appreciate Congressman Auchincloss coming on board and talking about what the reasons why you need to support it and how the opposition tactics are, really just them playing with monopoly money at this point, putting in the scare tactic of it's going to raise premiums, 34,000%, kind of like they raised the MS drug.
Their premiums are apparently going to go up the way their special, quote, specialty medications go up. Right.
Exactly. So, yeah. And so I think that's really important. And I'm so glad that there has been such a support for this bill, because I think that in other PBM reform efforts, people have not seen it get this kind of support so quickly. And that has frightened some owners. And they thought, oh, man, it's hard to talk to congresspeople. And it's, a little daunting to try to get them to understand, we see those losses on reimbursement every day. And so it's kind of like that 300%, you kind of have blinders to that after a while, because you're like, oh, I only lost $25 on this.
Yeah.
Okay. That's better than the, $500 that I lost for that other one.
And so to level set, right. They create this reality, and we're all living in this world. And just absolutely wrong practices become normalized, right? And a pharmacist who's caring for a patient, who's a beneficiary under a federal plan, should never lose money caring for that patient, right? Period. It's not normal. But to your point, pharmacists almost get numb to the low margin or small losses, right? And it's the big ones. I mean, you're right. But one thing that I would say that we find is, and some of this, again, can be esoteric. And, sometimes I think, legislators at the state and federal level hear a pharmacy say, oh, hey, we're losing money, or, hey, they're gouging patients. And it, right? But man, when you go into a pharmacy or when you visit with a pharmacist and they hand you, and I've seen them, I know people can't see it, but, this is my losses for the last 6 months, and it's a ream of paper, and these are government plans, it resonates. A lot of these Congress people, they care about their constituents, they care about small businesses, but they're also business people themselves, and they know that what, that's not normal, and it's not sustainable. And so taking the time to share those experiences, again, it might be normal to the pharmacist, right? But for anybody outside, they hear losses. It's tough to contextualize. But when somebody hands you a ream of losses, or they show, hey, this is what a DAW9, a Dow9 code is, and this patient was indeductible, and they had to pay an extra $300 out of pocket. And oh, by the way, the PBM clawed $50 of that back, and they see it, and they say, oh my God, a government contractor didn't pay out of pocket anything. They actually made the patient pay hundreds more so they could collect a 30 to 50% rebate, took $50 back from the patient, took $50 back from the pharmacy. My God, right? Like, under the auspices of being a government contractor. And this is what they're doing. They're fixing prices. And look, if you're in Medicaid managed care, they're going to reimburse that pharmacy low. They're going to charge the state high. They're going to fix that price low. If you're in Part D a year ago, they're going to reimburse that pharmacy sky high so that the patient is paying a larger cost share. And then they're going to claw that money back, right? So literally what they are doing is price fixing. And so it's so ironic when they go into offices and they say, hey, moving to a transparent index model is somehow price set, right? Now, they're the government contractor, and they're the ones setting and manipulating those prices. And it's not normal. And I think that's one of the things I love about this legislation. Hey, we don't need, to study it for 3 years in a report and a regulatory agency to spend 4 years writing code at this point, right? Patients need to stop being steered now. Pharmacies need to be reimbursed now, and everybody needs transparency in implementation now. And I think that's really important, because this isn't retrospective transparency. This is transparency in implementation. The patient will be paying a cost share. The pharmacy will be reimbursed. The federal government will be making the payment, all off of the same drug price. No more arbitrage.
Well, the crazy part is that we're told that the PBMs are able to access our prices through, a multitude, either the switch, or other ways that they have that access. So they have that data. So that's how they can knowingly underpay us. And they know that, okay, my pharmacy bought this drug for $50. I'm going to pay them $37.
Yes.
So they already know that information. So having the transparency there to also make sure that NADAC can't be manipulated, I think is so important, because then everyone's able to see the same cost, the same price, all of that reimbursement level. And so that way there won't be those, one pagers with the different chain stores getting reimbursed differently than the independents and all that. So that's really what we're trying to do, because we know they can't beat it. Chains cannot beat us on customer service. Ever.
Yeah. And again, free market, right? Let the patient choose the pharmacy based on service and care, right? Everything else is equal here. Let them choose based on service and care. And you know what? I mean, because there are situations, and we've got a white paper coming out this week on it, right? And we also looked at it into the Georgia State Health Benefit Plan, where a patient could walk in and pay $3 for atorvastatin and go up the road and pay $89, right? Or pay $90. In a federal plan, we're seeing very similar, where the pharmacy independent pharmacy may be reimbursed $13 for atorvastatin roughly, and then it's upwards of $80 at certain chain pharmacies. And so again, massive price fixing within the federal government, and it's the PBMs that are fixing those prices, and they're government contractors and subcontractors. So.
Absolutely. And there's, taxpayers that are paying into these different plans, and, patients that are just getting ripped off time and time again. And so the fact that the PBM lobby can go in and say some of their tried and true talking points, I've seen them at every single state level hearing that I've watched.
Nobody's watched more. Lauren has watched. She's got the record. I know it.
Just under like 1 million, I think, that I've watched. It's been 0 days since I've watched a state committee hearing that I
I'm not. I've been in hearings in Georgia, and Lauren will be like, "There's something on your forehead." And I'm like, "Oh my God, what's happening?"
or great shirt, Greg, way to choose the blue today, you know. And so that's really but my job at PUTT is to make sure that our members can have the access and have the resource of knowing what other states are doing, because that's so important. Because as Congressman Auchincloss alluded to, you know, yes, a legislator loves telling their constituent yes. And so if you can go forward and tell your legislator you should support a bill that we have put forward because of being able to save the independent pharmacy in our community, being able to help lower prices at the pharmacy counter, and being able to make sure that there's not additional abuse happening in either the state Medicaid program or other federal programs, this is, you know, the bill that we've been really waiting for.
Yeah,
and so I think that's really important.
And I would say you guys, if I could brag on PUTT just a little bit, right? You guys have armed your membership to do that. And it's so easy to cling to the status quo, right? And it's so easy to say, well, you know, boy, a bill like this has never been introduced before. And I think, you know, when you look at Congress, right, for somebody like Congressman Auchincloss and Harshbarger to be willing, in a world where there's 50 or 60 PBM bills and they all look pretty much the same, to be able to branch out and say, you know what, let's get to the root of the problem. Let's go ahead and introduce this, right? I mean, that's a huge step, and believing in the policy that community pharmacy has to offer. And I think it would be, you know, so easy, right, for PUTT. Again, there's a million bills, or not million, but 50 to 60 that PUTT could get behind. And it can be intimidating, and it's hard, and the bill was introduced late. But I just, you know, personally, you know, I have been inspired to see the work that PUTT and the PUTT board has put into this, and Monique, and you know, look, people wouldn't believe the hours, I think, right, that your board members have invested in this and willed this in many ways to the co-sponsors that it already has, and growing. And I do anticipate that we're going to be growing that. So,
absolutely,
yeah, we do too. For anyone who's listening, if you have been talking to your congressperson and you have encountered resistance, as I have, talking to my very own congressman in his district, I would just say, don't be discouraged. Just, you know, keep having the conversations, because you will get there.
Absolutely. And you never know what of the different talking points that we have, whether it's the paper that Greg put together, whether it's, you know, Congressman Auchincloss's tweets, whatever it is that's really going to get your legislator to tip to their favor and support. You know, it could be that someone in their office, someone in their life was recently diagnosed with MS. So that statistic of 35,000% increase because there hasn't been regulations on PBMs at the federal level should make everyone who's encountered that disastrous disease, you know, on edge, and should really motivate them to say, this needs to stop now. And the fact that I love the fact that he is not pushing this out, you know, waiting until 2028 to really have any kind of potential help for pharmacies, because we're seeing pharmacies close every day. And so there, you know, won't be that many left. And so that means patients, again, will not be able to have the care that they deserve. So I think that finding the pharmacy champion at the state level has always been a really important goal of PUTT. And so finding federal champions for PBM reform and finding people that are supportive of independent pharmacy issues, and not just saying, you know, man, that sucks. Because that's usually what they say, like, that's too bad. What are you doing wrong? You know, what can we do to help you? Well, I'm glad you asked, because HR 9096, getting us that reimbursement, getting the rebates distributed the way they should be, getting all of the people to look at the problem and the burden that PBMs and insurance companies have placed on patients and on smaller pharmacies. You know, there are some discrepancies in pricing on the chain stores too. I know, Greg, you looked at that whenever you saw grocery versus specialty versus all that. So and
we see chains frozen out of the specialty market all the time, right? So there's, you know, there are games that are being played across the board. So, but, you know, very much agree with your point about finding pharmacy champions. And, you know, one thing I'll say, and I think you guys would agree with this, but, you know, there's a lot. it's hard to find, it's hard to find somebody to introduce a bill, but to find a champion who is willing to just invest their time. Again, keep in mind, these folks could introduce a bill on anything, and there's literally thousands of different potential issues where somebody could be introducing legislation to address, right? And Congressman Auchincloss, who's, what I would venture to say one of the smartest people up there, and then on drug pricing, again, one of the smartest people up there, and to pick up this mantle and fight the way he is fighting. And so, my ask would be, and I know pharmacists are busy and they're behind the counter, and it's a rough year, but you've got folks in PUTT that are fighting passionately and furiously. You've got a bill sponsor that is fighting passionately and furiously. This is the time to join that fight and to engage in that outreach.
Absolutely. And we have tools that you can utilize. There's pharmacists that have set up QR codes or different flyers at their checkout counters to make sure that patients can access and easily contact their legislators, whether it is through an email, whether it's through a phone call. I know when my sister was a intern out in DC, and I'm obviously in the farmland here in Illinois, and there was a farm bill that was being discussed several years ago. They were trying to get some different changes made to that. There was an individual who called about chickens, and my sister said they answered the phone about chickens being impacted in the farm bill for 5 hours straight that day.
Yep. And you know what? Like chicken farmers, their lobby in certain states, no joke, right? They, those chicken farmers don't mess around. So,
absolutely. So do not be afraid to contact your legislator about things that impact you, because if you want to keep going to the pharmacy that you want to go to, your trusted individual pharmacy, you can do that if you get the support for this bill. This allows those, narrow networks to be thrown out the window. There is no reason why patients should have to suffer access and choice because some insurance company decided, I think it might be cheaper if I go with this big box store, 6 miles away from every patient in your town. That should be probably the better choice. So I think this is what is really important to remember, that, we work with patients every day. We see them at the pharmacy definitely once a month, once a quarter. Your legislator can hear from you and say, I want to keep going to this pharmacy. I want to keep going to the pharmacy. Owners, you need to tell your legislator that your employees depend on your store being open.
Yep.
So that's what's really important. All the people that you are advocating for, it's not just you. It can, there's owners that are embarrassed that they're in the position of, oh my gosh, I might have to sell my store in the next few months. The wholesaler bill, just keeps creeping up, and payroll and taxes and all that. So I think you really need to remember that you are fighting for all the people that are working in your store, that come to your store, and that get a benefit from you being in the community and supporting the other local businesses and your community. So there's a lot of people that this bill can impact. And I think that's important to remember, that you may be one voice, but you also touch a lot of different people that can impact your legislators.
Yeah.
So that's what the PBM lobbyists and the insurance company, that's why they can't be a fiduciary to our patients, because they don't put any regard for them. They have no desire to put them first in anything. Yeah. So it's, profits over patients for them.
That's right. And to that point, I don't know if we've touched on this yet, but out of the 50 or 60 bills that are out there, guess which bill they're working the hardest against right now? Right? It's the Pharmacists FIght Back Act, right? This is a bill that was introduced late, that hasn't been through committee, that hasn't been scored, and it scares them so much that that's the bill that they're fighting. That's the one that hits the live nerve. But everybody who's going in there to talk about, to talk against that bill and try to slow that bill down, they're being paid. They're being paid by insurance companies or PBMs or managed care or, somebody with some interest, right? And so, when they hear from constituents and they hear from those Main Street providers who care for their communities, who employ in their communities, who are leaders in their communities, that voice rises up and is just so much more powerful than the army of paid talking heads.
Absolutely. And I know I absolutely hate whenever the lobbyists use the example, PBM lobbyists or insurance lobbyists use the example of us cherry picking those losses. There's no cherry picking about the losses of, that the fact that you may get 3 claims every 15 minutes that are paid, not just over the cost of dispensing, but also have an adequate dispensing, that fair.
Yeah, that's right. And, and the other thing is look, with the white paper that's coming out this week or the Georgia State Health Benefit Plan, we're looking at the most commonly prescribed generics, right? These are the drugs that pharmacies are filling over and over and over again. There's no cherry picking there. And when you start getting into the quote specialty or the drugs that are required to be filled at the PBM and specialty pharmacies, there is cherry picking, but they're the ones cherry picking, as Congressman Alcala said, right? They're targeting, and again, like what's normal, right? This is not normal, even if it's become normalized. They are targeting the sickest patients, and they are forcing them out of the provider of their choice into their channels, forcing them to fill those drugs at PBM-owned pharmacies, marking them up thousands of %, and then directing rebates not only to the PBM, but also drug manufacturer rebates around to the affiliated pharmacy. So they're getting massive payments from the drug manufacturers, massive payments from the patients, massive payments from the taxpayers, right? Not normal. So there's cherry picking, but they're picking the winners and losers, and they are steering the winners into their channels. And that is the reality.
Oh, absolutely. And we saw this, discussion about specialty pharmacy in several other states. And so I think it's wonderful the fact that, Greg, you've really had a chance to dive into a lot of the pricing methodology, and you've gotten to see examples, and you really have done a great job of making it easy for people to understand, because sometimes people see those outrageous amounts and they think, oh, that can't possibly be right. That was just, a one-off incident. That was just, something was wrong there. That's not really it. And you're seeing consistently that they're getting paid astronomically more than they should be. And so that's really the important part of that.
And they're doing it on the backs of people who are literally fighting for their lives.
Mm-hmm. Yes, absolutely. So just in case you didn't think you could hate PBMs more, I think this podcast really shows how terrible they can be in a multitude of different ways. So luckily we have a pharmacy champions on the federal level, our friend Greg, helping us to make sure that people understand you can get behind this fight and support it. You can have your legislator support HR 9096, the Pharmacists FIght Back Act. Again, I'm not a pharmacist. I'm just lucky enough to be related to pharmacists. So I am standing with all of my pharmacy colleagues and the Pharmacists FIght Back Act, because you have never seen fury until you see a frugal pharmacist look through his loss report and see how much he could have been making had 9096 been implemented.
While still saving the system money.
Exactly. We've seen that on the state level where, some managed care organization had set aside $1 billion for their lawsuits that they were having against states, because they knew they were getting caught in several states by spread pricing whenever they shouldn't have been spread pricing. And so at one point there was, I think 17 different states so far have been paid by that managed care organization. Yeah. And I think that people really did appreciate the different, every person that spoke during that oversight committee hearing, they really let those PBM execs have it. And I think that really was something that pharmacy owners were looking for, because sometimes the questions can be a little too, not soft, but, where they already know the answer to the question. And so the questions that they were throwing out to these PBM execs during that oversight committee really showed the growth of what legislators have been educated on the Hill.
Oh, I agree. I mean, it's pretty neat to see that, because, 3 years ago, 4 years ago, 5 years ago, it would have been like, what does the P stand for in P? So there's been, massive, massive progress in that regard. And not only they know what they are, but they know that, they may not know everything, but they know that that they're implementing practices that are harming pharmacies, patients, and taxpayers. So,
and they can usually recognize at least one of the names whenever you show them, the chutes and ladders vertical integration flow chart that happens. And so they can say, oh, I've seen that on, one of my insurance cards before. I've seen that name on a advertisement for, a Part D plan, so they see these names, they recognize them. But thank goodness you are in our corner, Reybold. We're very excited for that.
Hey, we're trying. We're trying.
Thank you for joining us for this episode of the PUTTcast. If you don't know us, we are from Pharmacists United for Truth and Transparency, or PUTT, and you can join us at truthrx.org, and you can get a multitude of different resources. You can sign up for our newsletters. You can follow us on social media. You can really get a wealth of information from all of our outlets. You can also donate to our cause at truthrx.org/donate. We appreciate your time today, and hopefully you'll join us for the next episode of the podcast.